This is the RayScan Alpha Expert 3D. This is our pan, CBCT, and cephalometric model. As shown, we have the optional ceph hanging off the left side, but you can also imagine it without the ceph. We have just the pan and 3D modes to my left, which makes the footprint a little bit smaller. But even with the ceph, the width of the machine from far left to far right is much smaller than most other pan-ceph CBCT units in the market. So for the RayScan Alpha Expert, the machine that we have here, it's a very simple and easy to use machine. So on my left, we have our dedicated pan and CBCT sensor inside of the cover here. Our X-ray generator is over here, which is what's using the automatic or the advanced cooling technology. So if you're taking a lot of shots back to back to back, there's no hesitation in between shots. The machine's cooling itself down to protect the components, which are relatively expensive, but also to allow you to continue to function without having to wait in between shots. You'll notice that we have a blue LED. These are actually used to indicate the status that the machine is in. So right now, the blue LED is indicating that it's in a ready mode, getting ready to prep the patient, get into the software, and begin to take the image. It can also turn to a yellow while it's shooting radiation. It will turn to green when it's in a ready mode for actually firing radiation. So whenever the LED is in green, when you hit the exposure button, radiation is going to come out of the machine. And then if there's some sort of error or issue that requires some user intervention, the LED will turn red to give an indication that, hey, something may not be exactly right and it does need some attention. So when the patient is ready to take a shot, the patient would simply step into the machine. We have two simple temporal supports that can be adjusted by knobs on either side. The patient would rest their chin on the chin rest. They would bite their anterior teeth into the grooves onto the bite stick. Once they're in, we would move over to our intuitive touchscreen, and we can simply turn on our lasers. And we have 3 positioning lasers. So once the patient is in the machine, they can see themselves in the reflection in the mirror in front of them, which allows them to also position themselves, and you can position them as well to get the optimal positioning, to get the optimal image quality. The 3 lasers are a Frankfort plane laser going from the bottom of the orbital socket to the center of the patient's ear. You have one going from the mid-sagittal plane so that they're not looking to the left or to the right. And then you have one going across the patient's upper right canine to make sure they're not too far forward or too far back in the image so that you get good, clean anterior and canines in your panoramic image. Once they're positioned, you would instruct the patient to simply hold their hands underneath for this ring right here to give them some additional stability. We can close the temporal supports as a subtle reminder not to move your head and stay still during the image. We also have a remote control which would allow you to move the machine up and down, turn on the lasers, and put the machine into a final ready mode, which can all be done from the intuitive touchscreen here on my left, but if you can get a better view from around the corner or from behind the patient so you can see the mirror and the positioning lasers more effectively, you can use the remote to move the machine up and down as needed. Once the patient's in, we can press the ready button on the remote, or we can press the ready button on the screen, and the machine will move to a status where it is ready to shoot radiation and accept radiation to produce an image, and then the blue LED will change to green. Before we do that, we also have options on the touch panel to decide what we actually want to shoot and how we want to shoot it.